treatment for primary hyperparathyroidism. As we talked about in the last video, primary hyperparathyroidism is a disorder where one or more of the parathyroid glands is producing too much parathyroid hormone, and that results in an elevation and a persistent elevation of the calcium level in your bloodstream. That calcium is often being pulled from the bones, and it can result, therefore, in bone loss, osteoporosis, and fractures. And then that high circulating calcium is filtered through the kidneys, can result in kidney stones, kidney damage, etc. It can also result in some subtle symptoms like fatigue, anxiety, and mental fogginess. And the treatment for primary hyperparathyroidism is basically surgery. So who should have surgery for primary hyperparathyroidism? Does everybody who has this disorder need surgery? The answer is no, not everybody who has this disorder needs surgery, but surgery is recommended for certain circumstances. Certainly, surgery is recommended for anybody who is symptomatic from the hyperparathyroidism, meaning that they have kidney stones, they've had fractures of the bones when they would otherwise not expect to have fractured a bone. These are less common than they used to be because now most of the time this disorder is not identified just upon somebody breaking a bone. Occasionally it is identified in the evaluation of kidney stones, but more often it's found just on routine blood work. A person gets routine blood work at their doctor's, they're found to have high calcium. Further testing is done and it's found that their parathyroid level is elevated. So most people in today's day and age, with the relative frequency and how common routine blood work is for most of us, most of the time this disorder is found incidentally, and the person basically has no symptoms. They have asymptomatic primary hyperparathyroidism. So who should have surgery? Well, there are some criteria that we have that when people meet these criteria, we strongly suggest that they have surgery. And there's a list of them. If you're young, age under 50 is suggested as a reason to have surgery. And the reason is because you're going to be subjected to this situation biochemically in your body for so long. Presumably you have 30, 40, hopefully more years to live. And all that time, your bones and your kidneys and your whole system is going to be subjected to this metabolic disorder, and you're likely to develop a problem. So age under 50, it's recommended that you have surgery. If the calcium is very high, it's recommended that you have surgery. It's considered to be high if it's more than 1 point above normal. If you have bone loss that's significant, bone loss is measured on bone density testing, and bone loss beyond a certain amount, it's measured in something called a T-score. Beyond 2.5, minus 2.5 on the T-score, it gets considered significant, and it's recommended that the person have surgery even if they didn't know they had the bone loss. If the calcium level in the urine is very high, greater than 400 milligrams in a 24-hour urine sample, it's recommended that a person has surgery because it's felt that that high level of circulating calcium puts the kidney at risk for damage and stone development, etc. And if there's kidney dysfunction, if there's evidence of decreased function of the kidney, that's often that's felt to be a reason to have surgery because it's felt that that is the beginning of a further process of kidney damage. And then people can choose to have surgery. They may say, well, I don't want to just sit around and leave this alone and wait until it gets bad enough. I'd like to just get this taken care of. And that's a reasonable position to take. You don't have to just wait until it gets more severe. You can say, let's get it taken care of. So how is that done? How do you take care of this? What's the treatment? The treatment is basically surgery. And what the goal of the surgery is to remove the abnormal gland or glands, leaving the normal ones in place. and to bring the parathyroid hormone level down to normal. So we usually start preoperatively by trying to identify which gland is the culprit. There are a variety of scans to do that. We use ultrasound. There's a scan called a sestamibi scan, and there's a special kind of CT scan that we use, all of which are designed to try to identify which of the 4 glands is abnormal, which of the 4 glands is overactive and overgrown. The scans are very good, but of course they're not perfect, so there's an element of not knowing for sure which gland it is or whether it's one or more than one until you actually get in there at the time of the surgery and see what they look like. But the goal of the surgery is to remove the abnormal gland or glands and to bring the parathyroid hormone level down to normal. And we actually check the parathyroid hormone level at the time of surgery, before a person goes into the operating room, and then after we've removed the overactive gland, we actually check the blood test again right there in the operating room to make sure that it's come down to normal. And if it has, then we know that the remaining glands are functioning normally. If the parathyroid hormone level does not drop to normal, we have to consider that another one of the glands could also be overactive, and we have to look very carefully to see which one or ones may be elevated. Again, the goal is to remove the hyperactive, overgrown parathyroid or parathyroids and leave the normal ones. And the success rate of the operation is around 97-98%. So it's an effective and very safe surgery. So I hope that was helpful, and thank you for listening.